We'll go ahead and get moving on this. So I am Marissa Whitehouse. I am the Senior Medicare Patrol Program Manager here at ACL. I am very excited to share information with you today about the Addressing Diversity, Equity, and Inclusion in SMP state programs, competitive funding opportunity, information on that funding opportunity, and hopefully answer any questions that you might have at this point, and perhaps gather a few more questions that aren't covered in the NOFO. If you have questions throughout this presentation, please enter them in the chat. I will get to them once I finish content today. I have muted everyone just to make sure that we still have some quiet on the line as people come and go, but I will unmute you all so that you can ask questions, assuming that time allows at the end of the call. Today we will cover the funding and program overview. We will cover award information and responsibilities, eligibility, application and submission, application details, what the application review will look like. And this is being recorded for anybody who needs to know that. So just keep that in mind. It will be available later. Application details, application review, award administration and reporting, required forms, and questions. We'll take those at the end. This funding opportunity, there is information that is already posted on the ACL website. I am going to take a moment to paste it in to the chat, the link. There we go. So that is the link to the ACL site. It is also available on grants.gov, but the link should be available there in the hyperlink that I just sent to you. So I hope that I answer all of the questions that you already have in your mind as we walk through the PowerPoint today. But if there's anything that I don't cover or that isn't specifically included in the NOFO narrative, please be sure to take note of all of that information. So moving along. Funding overview. Funds awarded through this application are for 18-month project period. That will run from September 1st, 2022, so this coming September, through March 1st, 2024. For all of you current SMP grantees, you know that that is past the 5-year period of our typical SMP program. We're aware of that. We wanted to provide any those of you who do receive this funding opportunity with enough time to be able to put your plans in place and get some real progress done related to diversity, equity, and inclusion. Eligible applicants include current SMP state project grantees in good standing with ACL. Approximately 8 one-time new cooperative agreements will be awarded to support current SMP project grantees in the amount of up to $150,000. So that's anywhere from $75,000 to $150,000. The due date for applications is July 18th, and the anticipated announcement award date will be, we'll let you know by September 1st if you have received this funding opportunity, but hopefully before that. So please do note that applications that fail to meet the application due date will not be reviewed and will not receive any further consideration. So this isn't something that I or Rebecca or your project officer can help you with. If you miss the deadline, we can't work around that. So please be absolutely sure that you have submitted your application we recommend a minimum of 3 to 5 days prior to the application closing date, just to make sure that there are no hiccups. You all know that these systems can be a little challenging at times, so don't wait until the last day. So in case you encounter technical difficulties, grants.gov can take up to 48 hours to notify you of a successful submission. So program overview. ACL is looking for applicants to propose action plans which will further diversity, equity, and inclusion within their local programs in both the management of the programs and the execution of the SMP project via both public education and outreach efforts. The SMP mission, as you know, is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. So the purpose of this funding specifically is to focus on all of that while advancing diversity, equity, and inclusion. Proposed strategies could include the promotion of state and local partnerships, identification and implementation of promising techniques, and development and dissemination of outreach and educational materials to assist the SMP project grantee, yourself, and local program efforts. As I mentioned, we have about $1 million, and we anticipate funding up to 8 awards. So we won't necessarily fund 8. It could be less, it could be 7, depending on what types of applications we receive. It's hard to know exactly how many we'll receive, what the quality will look like. And so that information will be available once the panel has reviewed everything that's been received. And again, this will be for an 18-month project period and budget period. So priority activities. The overall goal of this funding opportunity is to advance diversity, equity, and inclusion in the SMP program, as we talked about, through the award of individual one-time funding to select state SMP projects. ACL will be looking for applicants to submit action plans, which will further diversity, equity, and inclusion within the applicant's local SMP programs in both the management of SMP project and education and outreach conducted. So all current SMP project grantees are eligible for this competitive funding opportunity, assuming you are in good standing with ACL. So that means that you have adhered to all of the reporting requirements thus far in your 4 years of SMP funding. And yeah, we look forward to all the applications that we receive from you. Applications should propose plans to address diversity, equity, and inclusion in their program in both the immediate and long term, and which could be replicated by other SMP projects in the future. So we at ACL are always looking for new, innovative, scalable, successful ideas that grantees may be able to apply in not only their states, but their peers may be able to take bits and pieces to apply in their own states as well. These plans may include the promotion of state and local partnerships, identification and implementation of promising techniques, analysis of data, assessment of program processes, and or the development and dissemination of outreach and education materials to assist the SMP project grantee and your local program efforts in reaching Medicare beneficiaries and partners. So it's important to propose plans that do focus on diversity, equity, and inclusion, while also considering the mission and the goals of the SMP program overall, because we do still need to keep those in mind. So what is the purpose of this funding? It is to identify gaps and barriers in the SMP project's service to Medicare beneficiaries. So what are you doing in your state, and where are we potentially missing people? Increase awareness, empowerment, and actions taken to prevent healthcare fraud among populations thus far generally underserved by the SMP program. So who is at high risk of fraud, errors, and abuse, and who may need to hear our message who we haven't been able to reach successfully in the past? Expand upon and use strategic collaborations with federal, state, and local community partners to increase the SMP project's reach. We know that y'all are all doing a good job thus far of reaching people in your state, but there are so many more people that we have not yet reached, who haven't heard our message, who haven't maybe become a victim of fraud at this point, which we are appreciative for, but we want them to have the information in case that ever does happen, so that they can be prepared. So last, adjust SMP project administration to address barriers to diversity, equity, and inclusion within program management, both at the state and local levels. So I'm going to talk about a few things that the applicants must do and then a few things that the applicant can do. So we'll start with must. So the applicant, under this announcement, applicants are required to design and implement activities which measurably, that's an important word there, enhance SMP program efforts. So specifically, the applicant must first clearly identify and describe how they plan to address diversity, equity, and inclusion within their program with this funding. They must identify the underserved or hard to reach populations which their activities will target, as well as any problems or barriers that may impact their ability to reach identified underserved populations. So what issues have you had in the past in reaching certain groups, and what do you anticipate will continue to be a challenge, and you know, what are the opportunities to work around those challenges? The applicant must provide plans for collaboration, which may include organizations like AAA's, No Wrong Doors, Assistive Technology, Aging and Disability Resource Centers, federally recognized tribal organizations, SILs, and any other community organizations as primary partners in fully integrated approaches to reach the identified underserved populations in their state or territory. So that is not a comprehensive list of organizations. It is a starting place for the partners and the collaboration that you may want to pursue. So we are not the experts on what exists in your state. You are, and we look forward to hearing about the diverse set of partnerships that you come up with in your applications. The applicant must describe the role and activities of partner organizations in achieving strategies for integrating healthcare fraud education awareness into the targeted areas. So what are those partners going to do? How are they improving upon your application? And how will they help you do what you need to do? The applicant must provide an ongoing plan for broadly disseminating lessons learned, strategies, approaches, and or materials developed to address diversity, equity, and inclusion to the broader SMP national network. The applicant must specify methodology for measurement and tracking of project outcomes, including, as it makes sense, the number of new team members, the number of partnerships added, the number of group educational sessions that were done in addition to normal numbers, outreach activities, or other activities identified to address diversity, equity, and inclusion within their programs. So we want to know exactly how you're going to count this information and how we will be able to measure success over time. Applicants must provide clear metrics and measurable outcomes that align directly to the plan being proposed. Applicants must propose grant activities not otherwise approved and or funded by ACL. So we need you to clearly specify as necessary how proposed work complements and does not duplicate previously approved SMP grant work, and how the newly proposed activities will advance diversity, equity, and inclusion in your state program. So please do not submit information from the application that you submitted in the past for your SMP base grant. We want to build upon what you've already planned to do. And last, the applicant must be in good standing with all current SMP state project program activities and reporting expectations. So now that we've gone through the things that you must do as an applicant, what might you consider including in your application? So depending on the action plans and work being proposed, applicants may consider providing a plan for development of materials and or training on best practices to successfully address diversity, equity, and inclusion. Those may include things like identifying underserved or hard to reach populations in your state, targeting volunteers and team members who are members of the identified populations and or whose expertise will directly support reaching those populations. They may consider or may include targeting beneficiaries, caregivers, or family members through intentional outreach techniques, and developing and or adapting recruitment, training, and support approaches to ensure understanding of and continued focus on diversity, equity, and inclusion amongst team members. The applicant may consider providing documented approaches to utilize media within outreach as it makes sense for you and your state. And the applicant may identify opportunities to focus on fraud, error, and abuse prevention in the identified targeted populations, in addition to detecting and reporting and referring fraud, errors, and abuse that have already occurred. So that is what the applicant will do. What will ACL be assured? What can you be assured that ACL will do? ACL will be significantly involved in the proposed project activities, much as we are for any of your other OHIC grants that you may be receiving. The terms and conditions for this cooperative agreement are as follows and will be incorporated by reference in the notice of award. So ACL will carry out the following activities for the cooperative agreement. ACL POs, project officers, will perform the day-to-day federal responsibilities of managing a grant initiative and will work with the grantees to ensure that the necessary requirements for the grant are met. ACL will assist the grantee project leadership in understanding the policy concerns and/or priorities of ACL by conducting periodic briefings and by carrying out ongoing consultations. ACL will work cooperatively with the grantee to clarify the programmatic and budgetary issues to be addressed by the project. So if issues are identified, ACL will be sure to work with the grantee to revise the project work plan, detailing expectations for major activities and products during the 18-month grant. ACL will provide technical assistance to the grantees related to the fulfillment of the goals and objectives of the grant. ACL will review and provide technical assistance on grantee work products as it makes sense or as necessary. ACL will provide consultation to the grantee in identifying emerging issues as they relate to the goals and objectives of this grant program. We will work with the grantees on the development and implementation of evaluation and quality assurance systems to ensure that performance is measured and that continuous improvement occurs. And we will attend and participate in major project events as appropriate. So this should overall mirror the ways that you interact with your project officer already. But just as a reminder, these are the things that we expect to do from day to day, week to week. So what does the grantee agree to do? So we talked about what the grantee may include in their application proposal, but now if you are awarded this funding opportunity, what are our expectations of you? To participate in ACL education and communication activities, including teleconferences, webinars, and monthly meetings to discuss grant-related activities and programmatic budget concerns. To share information with ACL, fellow SMP projects, and other national, state, and local partner organizations as appropriate. Common sharing activities include attending and participating in monthly SMP networking calls, uploading materials to the library, and disseminating best practices. So as a reminder, these funding opportunities are really, we want to progress these activities in each state. We also want to progress learning across the country. So we don't just want to increase diversity, equity, inclusion in those who receive this funding opportunity. We want to make sure that we're learning and growing nationally as a network, and that you are sharing all of your best practices, your challenges, the things that you struggled with, anything at all that may be of use to your peers. Grantees' responsibilities include participating in training opportunities. Recipients of this funding are required to send at least one person to the conference, the national conference, which this year will be held virtually, but this funding will cover next year's conference, which may be virtual or in person, depending on what's going on at that point. Since attendance was previously budgeted through SMP or your other program funding, travel funds should not typically be included within this budget. If you think that your plan does not apply, if you have a reason to send additional staff to the national conference, you can include that information in your application. As appropriate, grantees are expected to collect and input project performance data into the SMP data system, or SERS. You must do that timely in accordance with ACL guidelines and training. So all of this information that you would typically be putting in monthly into SERS, any additional activity should be also input into SERS with the same timeliness expectations and in accordance with ACL guidelines and training. You must include continual quality assurance processes to ensure that performance is measured and continuous improvement occurs. And grantees must include express acknowledgement on all SMP public information as part of the financial assistance award. So you are used to the blurb that you typically include on materials, and we do anticipate or expect that you will include the newest SMP branding information on any materials developed as well. Grantees must fulfill all of the requirements of the grant initiative as detailed in the program announcement. So be sure that you are clear on exactly what we're expecting of you within the NOFO, and include those details within your application. Eligible applicants. So only current SMP state project grantees who are in good standing with ACL are eligible to apply. There are no cost sharing or matching requirements, much as we do not encourage cost sharing or matching requirements on your base SMP grants or other OHIT grants. We do not encourage that here. Applicants that do not meet the responsiveness criteria will be administratively eliminated and will not be reviewed. For an application to be reviewed, it must meet the following screening requirements. So applications must be submitted electronically by the due date. We cannot work around that. If you don't get it in by the due date, we cannot help you. The project narrative section of the application must be double spaced, size 8.5 by 11, with 1-inch margins on both sides and a standard font size of not less than 11, preferably Times New Roman or Arial. All of this information is in the NOFO. You should find it, and it should be pretty normal for what the applications that you typically submit to us. The project narrative must not exceed 20 pages. Project narratives that exceed 20 pages will have the additional pages removed, and only the first 20 pages will be provided to the merit reviewers for funding consideration. So we don't want you to lose any of your important work. Make sure it's within 20 pages. Keep in mind that the project work plan, letters of commitment, and vitae of key project personnel are not counted as part of that project narrative for purposes of the 20-page limit. All right, so a little more information on application and submission. Application materials, as I said on one of the first slides, can be found at grants.gov or on the ACL.gov website in the Applying Grants section. Please note ACL requires applications for all announcements to be submitted electronically through grants.gov in Workspace. Grants.gov Workspace is the standard way for organizations and individuals to apply for federal grants in grants.gov. An overview and training on grants.gov Workspace can be found at a website that's included in the NOFO. I won't read it here. The grants.gov registration process can take several days. If your organization is not currently registered, please begin this process immediately. For assistance with that, you can go to grants.gov, or you can contact them at support@grants.gov, or call the number that's included in the NOFO, which is 800-518-4726. And that should be between the hours of 7 a.m. and 9 p.m. Eastern. Once your SAM registration is active, please be sure to allow 24 to 48 hours for the information to be available in grants.gov before you can submit an application there. This action should allow you time to resolve any issues that may arise, and failure to comply with these requirements may result in your inability to submit your application or receive an award. So start now so that there are no issues in July when this information is due. Additionally, all first-tier sub-award recipients must have a UEI number at the time the sub-award is made. Please review information provided in this section of the NOFO for details of this requirement. At this point, we are going to move into sections of the application that you should be sure to include. As a reminder, if you have questions up to this point about anything that I mentioned, feel free to go ahead and enter those things into the chat and we'll deal with them at the end as time allows. Letter of intent. So the due date for letters of intent is June 6th. 2022, so I believe that's in about a week. Applicants are requested, but are not required to submit a letter of intent to apply for this funding opportunity. That will assist ACL in planning for the application independent review process. So that really helps me. It really helps our review team understand exactly how many people we need to recruit and what the workload will be in reviewing. The purpose of the letter of intent, as I said, is to allow our staff to estimate the number of independent reviewers needed and to avoid potential conflicts of interest in the review. If we need to do some shifting of those who are submitting applications, those who are reviewing applications, then we are better able to do that if we know approximately how many of you are interested in applying. These letters of intent can be sent to me. The address is found here on the screen. You can send them here via email. You should all have my address available. So what goes into this submission? These bullets are the pieces of the project narrative that you should be sure to submit. So the project narrative must be double-spaced in the size that I mentioned before, standard font size of not less than 11, and smaller font sizes to fill in the standard forms and sample formats can be used just for those. So the suggested length for the project narrative is 10 to 20 pages, with 20 pages being the maximum length. The project work plan, letters of intent, and vitae of key personnel are not counted as part of that 20-page limit. So within the 20-page limit, we've got the summary and abstract, project statement, goals and objectives, proposed intervention, special target populations and organizations, outcomes, project management, evaluation, dissemination, organizational capability, and diversity, equity, and inclusion experience of the project team, if that's applicable. Forgive my crying cat in the background. The project narrative is the most important part of the application, as it will be used as the primary basis to determine whether the project meets the minimum requirements for grants under the authorizing statutes. The project narrative should provide a very clear and concise description of the proposed SMP project, and ACL recommends that the project narrative include each of these components. So, starting with summary here. This section should include a brief, no more than 265 words maximum, description of the proposed project, including goals, objectives, outcomes, and products to be developed. Detailed instructions for completing the summary and abstract section are included within the NOFO. Problem statement. This section should describe, in both quantitative and qualitative terms, the nature and scope of the problem or issue the proposed intervention is designed to address, including how the project will potentially affect older adults and/or people with disabilities, their families and caregivers, and the healthcare and social services system. Goals and objectives. This section should consist of a description of the project's goals and major objectives, and the proposed project goals and objectives should be reflective of the priority activities of the SMP program. Activities funded through this NOFO will have to be reported to ACL separate from base SMP funds, just as wedge funds were separately reported for virtual capacity building efforts. So please keep this in mind. Anything funded through this funding opportunity will need to be tracked separately from your SMP base funds. Proposed intervention. This section should provide a clear and concise description of the proposed intervention to address the problem described in the problem statement. Describe the rationale for using the intervention, including factors such as lessons learned for similar projects previously tested in the targeted communities or in other areas of the country. Factors in the larger environment that have created the quote right conditions for the intervention, with examples like existing social or economic factors to take advantage of. You should also note any anticipated major barriers and how the proposed intervention will address these barriers. Be sure to describe the role and makeup of any planned strategic partnerships in implementing the intervention, including other organizations, supporters, and/or consumer groups. This section, the proposed intervention, should also provide a detailed plan for the management and operation of the SMP project. Submissions should explain and justify their plan to address priority areas mentioned within this document. So plans must address the purpose of this funding opportunity previously discussed in the document. This includes the purposes, which are identifying gaps and barriers in the SMP project service to Medicare beneficiaries, increasing awareness, empowerment, and actions taken to prevent healthcare fraud among populations thus far generally underserved by your SMP program. 3, expanding upon and using strategic collaborations with federal, state, and local community partners to increase your program's reach. And 4, adjusting the SMP project administration to address barriers to diversity, equity, and inclusion within program management, both at the state and local levels. So please keep those important purposes of the funding in mind. Special target populations and organizations. This section should describe plans to involve federal, state, and local organizations in a meaningful way in the planning and implementation of the proposed project. This section should also describe how the proposed intervention will target commonly underserved populations. Moving on to outcomes. This section of the project narrative must clearly identify the measurable outcomes that will result from the project. So please note ACL will not fund any project that does not include measurable outcomes. This section should also describe how the project's findings might benefit the field at large. So examples of this might include how the findings could help other organizations throughout the nation to address the same or similar problems. Applicants should be aware that measurable outcomes cannot be duplicative of previously applied for and approved grant activities and must be measured and reported separate from other SMP grant funds. List measurable outcomes in the work plan grid under measurable outcomes in addition to any discussion included in the narrative, along with a description of how the project might benefit the field at large. This section of the NOFO includes details about how ACL defines a measurable outcome. I encourage you to go look at that definition to better understand how you should shape your outcomes to meet the goals that we're looking for. Applications will be scored on the clarity and nature of proposed outcomes, not on the number of outcomes cited. Again, outcomes funded through this NOFO will have to be reported separate from base funds, so keep that in mind. Project management. This section should include a clear delineation of how the roles and responsibilities of project staff, consultants, and partner organizations, and how they will contribute to achieving the project's objectives and outcomes. This section should specify the key staff with day-to-day responsibility for key tasks such as leadership of project, monitoring the project's ongoing progress, preparation of reports, and communications with other partners in ACL. It should also describe the approach that will be used to monitor and track progress on the project's tasks and objectives. Evaluation. This section should describe the methods, techniques, and tools that will be used to determine whether the proposed intervention achieved its anticipated outcomes and document the lessons learned. both positive and negative, from the project that will be useful in replicating the intervention if it proves successful. We want to help others understand exactly what worked and what didn't. This section should also describe a plan for evaluating the effectiveness of the proposed SMP project in achieving project outcomes. As we've already discussed, ACL utilizes SIRS to collect data, track, assess, and measure program outcomes, and the applicant, their plans must discuss priorities, activities, and staff capacity to capture project performance data accurately and timely. So, dissemination. This section should describe the method that will be used to disseminate the project's results and findings in a timely manner and in easily understandable formats. Recipients could include parties interested in using the results of the project to inform practice, service delivery, program development, and or policy making, especially those parties who would be interested in replicating the project. Dissemination examples should include sharing information with ACL, the SMP Resource Center, your SMP project network, and other national, state, and local partner organizations. So many organizations right now are seeking to focus on diversity, equity, and inclusion, and many of the learnings that you find will likely be helpful to other similar organizations and federally funded programs. So we would love to be able to share anything that you learn that results from this funding with our ACL peers as well. Organizational capacity. Each application should include an organizational capability statement and vitae for key project personnel. The organizational capacity statement should describe how the applicant agency or the division of the larger organization, which will have responsibility for this project, is organized, the nature and scope of its work, and or the capabilities it possesses. It should also include the organization's capabilities to sustain some or all project activities after federal financial assistance has ended. This description should cover capacity of the applicant agency not included in the in the program narrative, such as any current or previous relevant experience and or the record of the project team in preparing cogent and useful reports, publications, and other products. If appropriate, include an organizational chart showing the relationship of the project to the current organization. Those who are reviewing these applications will not be your PO, will not be me or Rebecca. So these individuals will likely not be familiar with your organizational structure. So it's always helpful to provide a visual. Please attach short vitae, 1 to 2 pages, for key project staff only, and neither vitaes nor any organizational chart will count toward the narrative page limit. Also include information about any contractual organizations that will have a significant role in implementing project and achieving project details. And last in the list of required sections or recommended sections is diversity, equity, and inclusion experience of the project team, if it's applicable. This section should describe the project team members' relevant equity experience that might be of benefit to the overall program. So for this section, project team members can be defined as both paid and unpaid team members, contractors, and partners who work as part of a specific agreement to support the goals of this diversity, equity, and inclusion project. This is an optional document section, but it's really helpful for us to better understand how you are going to implement your plan and what help do you have in doing that? What project expertise, what subject matter experts do you have available to you to do this work? All right. Additional application sections include the budget narrative and justification. Can be provided using the format included in the document in the NOFO. That section is called Budget Narrative Justification Sample Format. Applicants are encouraged to pay particular attention to this section of the document, which provides an example of the level of detail that we seek. A combined 18-month budget narrative and justification, which covers the full life of the award, is required. So please be sure to keep that in mind. We recognize that an 18-month budget is a little bit different than what you are used to for SMP grants, but please be sure to include all of those details for that many months in your submission. The project work plan should reflect and be consistent with the project narrative and budget. It should also include a statement of the project's overall goal, anticipated outcomes, key objectives, and the major tasks or action steps that will be pursued to achieve the goal and outcomes. For each of the major tasks or action steps, the work plan should identify timeframes involved, including start and end dates, and the lead person responsible for completing the task. Letters of commitment from key participating organizations and agencies are also extremely helpful to you. Include confirmation of the commitments and key activities or work, not just lending support to the application or to the project should it be funded, made by key collaborating organizations and agencies in this part of the application. So any organization that is specifically named to have a significant role in carrying out the project should be considered an essential collaborator. For applications submitted electronically via grants.gov, signed letters of commitment should be scanned and included as attachments. Applicants unable to scan the signed letters of commitment can also email them to me, the SMP project manager, though it's always best to include them in the system if you can. In your email, if you do email them to me, please just be sure to include the funding opportunity number and your agency name in the subject line. I want to make sure that these details are included with the correct application. The grants.gov registration process can take several days, as we talked about. This slide provides additional information about the unique entity identifier and system for award management. For assistance with this, you can go to grants.gov or you can contact them via email or phone with the information that I've provided before. If your organization isn't registered, please start this now because all applicants must have a UEI number and be registered in SAM. And all first tier sub-award recipients must have a UEI number at the time the sub-award is made. So we talked about this before, but just as a reminder, due dates for applications those are due on July 18th, 2022. The date for the informational conference call right now, May 31st, and applications that fail to meet the application due date cannot be reviewed. We will not consider them. We will not review them. In addition, if you are submitting your application via grants.gov, you must be designated by your organization as an authorized organizational representative and register yourself with grants.gov as the AOR. Details on these steps are outlined at the following grants.gov webpage, and that should match other expectations of your OHIC grants that you've submitted for. After you electronically submit your application, you will receive an automatic notification of receipt from grants.gov that contains a grants.gov tracking number. If you're experiencing problems submitting your application through grants.gov, please start early and contact the grants.gov support desk toll-free at 1-800-518-4726. You must obtain a grants.gov support desk case number and keep record of it. If anything happens, you start plenty early, you're unable to submit your application, we can be understanding if you provide clear documentation that there was an obvious electronic problem, but you'll need to provide that information to us. You are prevented from electronically submitting your application on the application deadline, if you are prevented from electronically submitting your application on the application deadline because of a technical problem with grants.gov system, please contact the person listed under the For Further Information Contact section of the NOFO, and we will work with them and provide you will need to provide a written explanation of the technical problem that you experienced, along with the grants.gov support desk case number, at which point ACL will contact you after a determination is made on whether your application can be accepted. We don't want to have to deal with any of that. We don't want that stress to be on you. So get started early to make sure that we can get any details of your application in. Funding restrictions. This is normal grants language. You should be familiar with this. Funding restrictions should mirror restrictions noted in your base SMP funding and come directly from ACL grants policy statements. So the following activities are not fundable: construction and other major rehabilitation of buildings, basic research, whether it be scientific or medical experiments, continuation of existing projects without expansion or new and innovative approaches. So don't submit something that you've already submitted to us. We want to hear great new ideas, and we look forward to those. Note, a recent Government Accountability Office report has raised considerable concerns about grantees and contractors charging the federal government for additional meals outside of the standard allowance for travel subsistence known as per diem. Executive orders on promoting efficient spending and delivering efficient, effective, and accountable government have been issued and instruct federal agencies to promote efficient spending. Therefore, if meals are to be charged in your proposal, applicants should understand such costs must meet the criteria outlined in the executive orders and HHS grants policy statement. These include rules such as meals are generally unallowable except for the following: for subjects and patients under study, usually a research program, or specifically approved as part of the project or program activity, when an organization customarily provides meals to employees working beyond the normal workday, as part of a formal compensation agreement, as part of a per diem or subsistence allowance provided in conjunction with allowable travel, and under a conference grant, when meals are necessary and an integral part of a conference, provided that meal costs are not duplicated in participants' per diem or subsistence allowances. More information about that is available within the NOFO. Develop a compliance plan to implement 2 CFR 200. I won't go into that level of detail. Look within the funding restrictions section because we want to make sure that you are able to follow those recommendations. Application review information. I'm going to relatively quickly go through the rest of these things because I want to make sure that there's enough time for you to be able to ask questions. So the application review process will include applications being scored by being assigned a maximum of 100 points across 5 criteria. So these criteria are listed here: project relevance and current need, approach, budget, project impact, and organizational capacity. Applicants must document all of their source material. If any text, language, or other materials are from another source, we ask that you make it clear what material is being quoted and where the text comes from. Please cite information and do not plagiarize. Reviewers are experts in the field, but not necessarily in our program, so they don't always have intimate knowledge of SMP or other OHIC programs. Applications should be written for an audience who does not know the program. This is a really important thing to remember as you prepare your application. Be sure to provide the level of detail that our reviewers would need. Pay close attention to the criteria for review and each specific question within each category. This section begins on page 19. An independent review panel of at least 3 individuals will evaluate applications that pass the screening and meet the responsiveness criteria if applicable, and a final award decisions are made by our administrator. Please keep this in mind. We are not the final decision makers, though the panel does provide the review that gives us the information we need to make these recommendations. In making decisions, the administrator will take into consideration things like recommendations of the review panel, reviews for programmatic and grants management compliance, the reasonableness of the estimated cost to the government considering the available funding and anticipated results, and the likelihood that the proposed project will result in the benefits expected. Successful applicants will receive an electronic notice of award, and the notice of award is the authorizing document you're familiar with that includes information of acceptance of the award. This is signified. The acceptance of the award is signified by the drawdown of funds from PMS or payment management system. Unsuccessful applicants are generally notified within 30 days of the final funding decision and will receive a disapproval letter via email. Unless indicated otherwise in this announcement, unsuccessful applications will not be retained by the agency and will be destroyed. This award is subject to the HHS administrative requirements, which you can find in the standard terms and conditions and included in the notice of award, as well as in HHS grants policy statements. Recipients of federal financial assistance from HHS must administer their programs in compliance with federal civil rights laws that prohibit discrimination on the basis of race, color, national origin, disability, age, and in some circumstances, religion, conscience, and sex. The reporting cycle will be reflected in the notice of award, but keep in mind that progress reports are due semi-annually from the start date of the award and are due within 30 days of the reporting period end date. Final progress reports and SF425 reports are due 90 days after the end of the project period, and grantees are required to complete the federal cash transaction portion of the SF425 within PMS. Agency contacts. So who can you reach out to with questions and who is responsible for this funding opportunity? That's me, Marissa Whitehouse, SMP Program Manager. My email address and phone number are included here. The grants management specialist assigned to the SMP program is Catherine Firing. Her email address and phone number are included here as well. I encourage you, if you have a grants related question, you want to send it to Catherine, please include me as well. I can also route any questions that are more applicable for her to her. On the second to last slide, you'll see the application elements. You'll see the required forms at the top of this page, and then you will see the as applicable forms at the lower part of this page. Please keep this information in mind. Don't miss anything that is required in your application kit. Come back to this page. And last slide. Now that you've gotten lots and lots of information about this funding opportunity, where can you send questions that come to you after the call today? You can always send them to me at marissa.whitehouse@acl.hhs.gov. And at this point, happy to open up the floor for questions. I can unmute lines, and I do also see that Rebecca already answered a question, which I can be sure to include in the FAQ that we're going to be compiling and posting. 1 second, I will unmute you all. Okay, you should have ability to unmute your lines at this point, hopefully. Feel free to unmute or raise your hand or type into the chat if you have a question. Will this PowerPoint be sent out to all SMP directors? Yes, I'll send the PowerPoint out to everyone as well as the link to the recording for this session. In addition, the FAQ that we'll be developing, assuming you have questions that we haven't answered, will be updated as additional questions come in, and we will keep it updated on the ACL website. I'll also send it out to the listserv as it's updated. What else? What have I not answered? We'll give everybody one more minute to think about it. And if nobody has any other questions, I really appreciate your time. I appreciate your interest in this competitive funding opportunity, and I'm so excited for this opportunity for you and your state. Assuming we have no other questions, we'll go ahead and oh, there's one. Is the funding a maximum of 150,000 per 12 months or over the 18-month period? The funding is a maximum of $150,000 for the full 18-month period. So the floor for this funding opportunity is 75,000. So it could be as little as 75,000 for the 18-month period. It could be as much as 150,000 depending on the applications we receive and the how much you anticipate needing for the plans that you submit. I'll keep this line open for the next few minutes. Feel free to leave the call if you have no further questions. Thank you all for your time today. All right, we'll go ahead and end today's call. Thank you.